Chapter 1, Fundamentals of Pharmacology. We will cover the key terms throughout the lecture video. Pharmacology is the study of drugs and their interactions with living systems, which includes chemical and physical properties, toxicology, and therapeutics. Knowledge of pharmacology is essential to the accurate, effective, and efficient performance of the responsibilities of a pharmacy technician. Pharmacy technicians educated in pharmacology have the skills to properly identify the drug from a patient's profile when refills are requested and the patient does not remember the drug name. Less time is spent searching for drugs when pharmacy technicians have good brand and generic name recognition. So knowing both pharmacology and brand and generic is going to be crucial to your future job and crucial for taking the PTCB. The pharmacology portion is 45%, I believe, right, currently. So this information we're going to learn in this book is going to be very important information that you will need to have a good grasp on. Plants have been collected, cultivated, and harvested for the healing properties and used in the treatment of illness for centuries. Contributors to the current knowledge about drugs span the globe. Records dating as early as 3000 BC document the pharmacological knowledge by the people of ancient Egypt, Mesopotamia, India, and China. Since the 20th century, research into medicines and the introduction of new drugs and vaccines have grown exponentially. Anti-infective agents, the discovery of insulin and its use for diabetes, antiretroviral drugs for the treatment of HIV and AIDS, those have all been discovered since the 1930s. The study of genes has enabled scientists to develop new genetically modified drugs such as human insulin. Bioengineering is the process used to produce biopharmaceuticals. Box 1.1 shows a pharmacology timeline. 3000 BC, we had Imhotep, an Egyptian god of medicine. We'll scroll down a little bit. 400 BC, Hippocrates, the father of medicine. AD 120 to 200, Galen, the father of pharmacotherapy. And we have quite a few in the 1700s. William Worthing from United Kingdom, isolated digitalis from foxglove. We still use that today in medications. Edward Jenner developed the vaccine against cowpox, which led to the development of the smallpox vaccine. In the 1800s, we had Frederick Serturner from Germany who extracted morphine from opium. Louis Pasteur's experiments showing that microorganisms can cause disease and heat can kill them because the basis of germ theory. And he's also responsible, if you look at his last name, he's also responsible for pasteurization of things like milk that we use to this day. In the 1900s, we had Gerhard Domag from Germany who introduced the sulfonamide parenteral. It was the first anti-infective agent. Alexander Fleming in the United States discovered penicillin, a chemical produced by fungus. So that's huge for us in the United States. Bayer from the United States was instrumental in the development of thiazide diuretics, derivatives of sulfonamides and other drugs. And in the 2000s, we had quite a few things as well. Immunobiologic therapies such as monoclonal antibody immunomodulators, monoclonal and mTOR inhibitors were introduced, which we've talked about a lot in this mod. Vaccines to prevent HPV, a new antiviral therapy for the treatment of HIV and AIDS, a hepatitis C medication. And of course, we have now other things we can add to this timeline, like the development of a COVID-19 vaccination. Pharmacognosy is a term derived from the Greek word pharmakon, which means drugs, and gnosis, which means knowledge. It is the branch of science dealing with the study of the natural origin of drugs. Pharmacognosy is the study of the constituents of natural drugs that are responsible for their effects. A drug is a substance that affects the normal function or structure of humans or animals, and it may be used to diagnose, treat, mitigate, cure, or prevent diseases. Drugs can come from natural or synthetic origins. Natural drugs may be derived from plants like digitalis and quinine. They can be derived from animals like thyroid or pepsin. Minerals like silver nitrate. Some common beverages and foods are natural drugs. Coffee and tea contain the drug caffeine. Ginger and peppermint contain ingredients that can reduce nausea. Fentanyl is a synthetically manufactured analgesic that is more potent than the natural drug morphine, which is the natural occurring analgesic derived from the opium poppy. Drugs may also be produced via the process of bioengineering. Erythropoietin and human insulin are examples of biopharmaceuticals. Table 1.1 lists drugs and their sources. So we have plants like foxglove, cinchona, opium poppy, and their generic names and what they're used for. For animals, we have the thyroid gland for hypothyroidism, pancreatin for the pancreas for a digestive aid. We have our minerals like silver and gold, silver sulfadiazine for burns, and aeronophen for arthritis. Then we just talked about synthetic opioid fentanyl. Red azo dye is sulfonamides that are used for infections. And then bioengineering, recombinant DNA technology. We have the hepatitis B vaccine and human insulin. Pharmacognosy and pharmacology are both sciences that involve the study of medicinal substances. However, the science of pharmacology involves the actions of drugs on humans and animals. The aim of drug therapy is to diagnose, treat, cure, or lessen the symptoms of a disease. The study of pharmacology applies knowledge of properties of drugs, mechanism of drug action, anatomy and physiology, and pathology. Selection of the appropriate drug for a patient in the proper dose and dosage form administered at an appropriate dosing schedule requires knowledge of pharmacology. The drug dose is the amount of drug units given for a single administration, like 2 tablets or 1 teaspoonful. The dosing schedule is the number of times the drug is administered per day. Pharmacotherapy is defined as the use of drugs in the treatment of disease. Contrasting philosophies about pharmacotherapy exist. Allopathic medication, sometimes called Western medicine, is a system of medical practice in which the goal of pharmacotherapy is to fight disease by using drugs or surgery that produces effects different from or incompatible with those produced by the disease being treated. In homeopathic medicine, drugs are administered in minute quantities to produce effects similar to the disease in healthy persons, yet stimulate the body's natural healing systems in individuals with disease. In 1906, the Pure Food and Drug Act was passed to protect the public from ineffective and harmful drugs. The act was expanded in 1938, and standards for allowing new drugs onto the market were set. Today, it can take several years to move a new drug from the idea phase to making it available to the public. Thousands of chemical compounds may be tested before one is discovered that can produce the desired effects with an acceptable level of adverse effects. So there are many steps in the development process for drugs. You can see that process start here from the applicant all the way down in figure 1.1. There are three clinical study phases. In phase 1, the drug is administered to a small number of healthy volunteers who are enrolled in the clinical study. Preliminary information about the drug's pharmacology, mechanism of action, and efficiency is gathered in phase 1. If appropriate, the drug enters phase 2 clinical studies. Phase 2 studies are controlled trials with a limited number of patients with the condition to be treated. During this phase, data is collected to determine the drug's efficiency and the drug's side effects in patients with the disease. Phase 3 clinical studies involve hundreds to a few thousand patients. Drug safety is evaluated and the benefit of taking the drug is compared with the risk associated with taking the drug. If safety and efficiency are shown, the drug begins the new drug application process and then moves on to review. An accelerated process exists to speed drug development and review when the drug provides significant benefit over existing therapies or a life-threatening illness is present. Phase 4 trials are studies that are conducted after the drug is marketed to the public to determine safety and effectiveness when the drug is used in real-world conditions. All drugs are identified by a generic name, a chemical name, and a proprietary name. The name of a new drug is made according to standards set by the Center for Drug Evaluation and Research. Every drug has a generic name. However, the drug cannot be manufactured by a generic manufacturer until the patent expires. So for the most part in the pharmacy, you're going to see probably more generic than brand. And the generics that are on the shelf are only going to have the generic name on them. The brand name is going to have both the brand and the generic on the bottle. So you'll be able to tell the difference between those that are branded generic when you're in the pharmacy. I've had students who have came back to me and said, every drug is listed by the generic name. And I'm like, well, yeah. If it's generic, it's going to be placed in the alphabetic part of the pharmacy under whatever letter it falls under. And if it's the brand, it's going to be placed under the alphabetic pharmacy shelves under the brand name. So just keep that in mind. Official drug names are non-proprietary names that are selected by the U.S. Adopted Name Council and must be approved by the FDA. The ending of the official name of many drugs indicates the pharmacological class to which the drug belongs. For example, many local anesthetics have the common ending cane. So this is really important to start paying attention to this in this module because we are going to start learning drug classes and we can identify drugs by their classes by looking at some of those common endings. That is going to help you out tremendously when you take the PTCB because you're still going to be learning medications at that point. So we have a table 1.2 examples of common endings to official drug names. So for benzodiazepine, a common ending is Zapam or Zolam, like diazepam or alprazolam. Corticosteroids, Sone and Lone are the common endings like prednisone and prednisolone. For NSAIDs, we have the common ending of Profen and Olac, like ibuprofen and Controlac. For beta adrenergic blocking drugs, beta blockers, we have OLOL, like propranolol. For H2 receptor antagonists, we have the common ending of tadine, like cimetidine. For proton pump inhibitors, we have Prazole, like omeprazole. For calcium channel blockers, the dihydropyridines, the common ending is dapine, like nifedipine. Macrolide ineffectives, common ending thromycin, like erythromycin. The proprietary name or brand name is assigned by the drug manufacturer according to nomenclature guidelines and must be approved by the CDER. Factors considered when selecting a suitable proprietary name are risk for medication errors caused by existing look-alike and sound-alike names and ease of association with the generic name or active ingredient name. Table 1.3 lists examples of chemical, generic, and proprietary names. So the generic name for the first one, fluoxetine hydrochloride. This is the chemical name. N-methyl 3-phenyl 3,4 trifluoromethyl phenox propran 1-amine. That's the chemical name. And the brand name is Prozac. So you can see we really are just going to focus on the generic and the brand names, but there is a difference between the chemical name. That is the actual chemicals. Brand names or proprietary drug names are commonly written beginning with a capital letter, and generic should be written with a lowercase. So when you go into the pharmacy and you see bottles that are brand and generic, sometimes it might be hard to distinguish, but you should see the brand bigger on a brand bottle, and the generic should be smaller on the bottle. The innovator of a new drug may apply for patent protection. If awarded, the manufacturer is given up to 20 years exclusive rights to manufacture and distribute the new drug. The manufacturer selects a brand name for the drug according to CDR recommendations. When the drug is off patent, other drug companies can manufacture a generic equivalent. Generic drugs contain the same active ingredient as the original manufacturer's drug in the same strength and in the same dosage form. Generic drugs, however, can contain different inactive ingredients. Occasionally, these inactive ingredients result in slight differences between brand name and generic products that affect how much of the drug is available to produce drug action or how quickly the drug effect is produced. Generic drugs are always less expensive than brand name drugs. In many states and provinces, pharmacists routinely dispense generic drugs. Most prescription drug insurance plans require that generic drugs be dispensed. Brand names are only dispensed when the prescriber insists that a brand name drug is necessary. So they would need to put DAW on that prescription. Technicians should concentrate on memorizing each drug's generic and brand name. Medication errors can also be avoided by arranging drugs on the pharmacy shelves according to the generic names. Many drugs look and sound alike. Technicians should be familiar with the Institute for Safe Medication Practice, the ISMP list of look-alike, sound-alike drugs. You can see that list at this PDF here. The Pure Food and Drug Act of 1906 was the first significant legislation passed to protect the public from harmful and ineffective drugs in the United States. Kind of already talked about this, but over the years, many more laws have been passed that regulate drug manufacture and distribution. The Durham-Humphrey Amendment established the distinction between legend drugs and drugs that could be safely used by the public without supervision by a healthcare provider. Legend drugs can only be obtained by a prescription, whereas over-the-counter OTC drugs do not require a prescription. RX only must be printed on the manufacturer's product label for all legend drugs. So if you look at any prescription bottle in the pharmacy that's strictly prescription only, you will see an RX symbol on it. You will also hear of behind-the-counter drugs in the United States, BTC drugs, in those categories, stuff like Sudafed, Plan B, and aspirin for pediatric use, lice treatments. There is insulin that can be bought behind the counter, only certain kinds. In the United States, the Combat Methamphetamine Epidemic Act of 2005 was passed to curb the illegal manufacture and use of crystal meth. The CMEA was signed into law on March 6, 2006 to regulate, among many other things, retail OTC sales of ephedrine, pseudoephedrine, and phenylpropylnamyline products are used to manufacture crystal meth. Purchase limits, placement of product out of direct customer access, sale logbooks, customer ID verification, employee training, and self-certification of regulated sellers are required provisions of the CMEA. The Comprehensive Drug Abuse Prevention and Control Act was passed by Congress in 1970. It regulates drugs that have a history for abuse in the United States. Access to controlled substance is more restrictive than access to legend drugs. Controlled substances are placed in schedules 1 through 5 according to their abuse potential and effects if abused. Table 1.4 lists controlled substance in the United States, schedules, classification, dispensing rules, and examples. So for Schedule C1, This drug has a high potential for abuse. The drug has no currently accepted medical use and treatment for the United States. So you don't see any C1 drugs in your pharmacy. They can only be dispensed with approved protocol or investigational use. So not at your regular pharmacy. And ecstasy, heroin, LSD, PCP, and marijuana are examples of C1 classified drugs. And although marijuana is legal in many states, it is still federally illegal. So that is why it is still placed under the C1. Even though it's been approved for, not approved, but it's been proven that it works for some medical cases as well. C2s, the drug has a high potential for abuse. Abuse of the drug may lead to severe psychological or physical dependence. The drug has an accepted medical use in the treatment in the United States. So for dispensing, we need a written prescription. If called in or faxed, a written prescription must follow within 72 hours. That's not necessarily the case anymore, I don't believe. I think it can be e-scribed. No refills are allowed. Methylphenidate, codeine, meperidine, oxycodone, hydromorphone, amphetamine are some examples. C3, the drug has potential for abuse less than that of C2. The dispensing rules can be written oral effects prescription, expires within 6 months, no more than 5 refills within 6 months. Some examples are Tylenol with codeine, hydrocodone with acetaminophen, methyl testosterone. C4 drugs, the drug has a potential for abuse less than that of C3. Same rules as C3. Some examples, alprazolam, butorphanol, diazepam, carisoprodol, phentermine, triazolam, naloxone. In C5, the drug has potential for abuse less than that of C4. And for prescriptions, we can do written oral effects prescriptions. The prescription expires within 6 months and no more than 5 refills within 6 months. Some examples, lacosamide and diphenylloxalate plus atropine for diarrhea. Drugs are formulated for delivery by mouth, injection, inhalation, or topical application to skin or mucous membrane. The factors influencing the choice are chemical properties, drug formulations, the human body. Oral administration is safe, easy, and generally more economical than parenteral administration. Common oral formulations include tablets, capsules, solutions, emulsions, syrups, suspensions, and elixirs. Tablets are solid dosage forms containing one or more active ingredients plus binders and fillers. Binders are added to aid in compressing the drug into a tablet shape. Fillers make up the required bulk and help bind the tablet. Binders and fillers are inactive ingredients but may influence the rate of drug absorption. Repeat action tablets are layered. The outer layer rapidly disintegrates in the stomach and the inner layer dissolves in the small intestine. Delayed action tablets slow the release of drug to avoid stomach upset, improve absorption, or prevent drug destruction in the stomach. Enteric-coated tablets are a type of delayed action tablet. Enteric-coated tablets do not dissolve in the stomach. They release their contents in the small intestine. So you can see figure 1.3 enteric-coated capsules. A is the scored side, B is the unscored side, and C is the interior. Sustained release and time release tablets deliver their contents over time. Film coating and sugar coating tablets make them easier to swallow and improve taste. Chewable tablets are formulated for people who have difficulty swallowing pills, which includes children, and a lot of their medications are available in chewable form. Sublingual and buccal tablets dissolve in the mouth. Orally disintegrating tablets or oral dispersible tablets are similar to sublingual tablets, but they disintegrate more rapidly when placed on the tongue. Pastels are solid medicated preparations designed to dissolve slowly in the mouth. Troches and lozenges are dissolved in the mouth. Thin film includes a thin layer of film that disintegrates or dissolves to release the drug and is applied to sublingual tablets, buccal tablets, and extended release tablets. Capsules are solid dosage forms containing one or more active ingredient plus binders and fillers. Capsules are formulated to deliver their contents immediately or over time. An osmotic controlled release capsule delivers the drug through a rigid water permeable membrane with one or more small holes. As the capsule passes through the body, the osmotic pressure of water entering the capsule pushes the active drug through the opening in the capsule. Oral liquids include suspensions, solutions, syrups, elixirs, tinctures, and emulsions. Typically, they are water-based. Drugs formulated in liquids are easy to swallow. Liquid medicines work more rapidly than tablets or capsules. Suspensions containing small drug particles, solute, suspended in a solvent. So some examples of that. We have a otic suspension, rectal suspension, and oral suspension. Syrups contain a high concentration of sucrose or other sugar. Elixirs contain between 5 and 40% alcohol. Tinctures may contain as little as 17% alcohol or as much as 80% alcohol. Emulsions are similar to suspensions. Drugs suspended in oil may be dispersed in water, or drugs suspended in water may be dispersed in oil. When suspensions are dispensed, a shake well auxiliary label should be placed on the prescription bottle. Solution suspensions and emulsions are also formulated for topical applications to the skin, eye, ear, and mucous membranes of the rectum and vagina. Topical dosage forms not previously described include ointments, creams, and suppositories. Eye drops may be placed in the ear, but eardrops should never be placed in the eye. And that is because whatever we put in the eye needs to be sterile, and eardrops are not. So we cannot put them in the eye, but we can put eye drops in the ear. Dusting powders are free-flowing, very fine powders for external use. Ointments are semi-solid preparations containing petroleum or another oily base. Creams are semi-solid emulsions. Vanishing creams have a higher water content. Cold cream is an oil and water emulsion. Hydrogels contain up to 99% water and are a controlled release drug delivery system. Suppositories are solid or semi-solid dosage forms intended to be inserted into a body orifice. They are shaped for vaginal, urethral, or rectal insertion. Suppositories melt at body temperature, dispersing the medication. The auxiliary label for topical use only should be applied to topical products that are dispensed. Patients should be advised to remove the foil or outer wrapper from the suppository before inserting it into the rectum or vagina. And yes, that does happen. Transdermal patches are control release devices that deliver medication across skin membranes into the general circulation. They produce systemic effects throughout the body in addition to local effects. Medicines formulated for transdermal application are used to treat angina, like nitroglycerin, male hypogonadism, like testosterone, menopause, like estrogen, pain, like fentanyl, ADHD, like methylphenidate patch, and Alzheimer's disease, rivastigmine. Parenteral drugs are injected or infused directly into a blood vessel, muscle, or joint. Parenterally administered drugs enter the bloodstream, often producing rapid action. In the bloodstream, these side effects cannot be easily stopped. To avoid introducing contaminants that are harmful if injected into a patient, pharmacy technicians prepare parenterally administered drugs using aseptic technique in a sterile environment. The following are examples of parenteral drugs. So picture A here, we have syringes. B, we have ampules. C, we have vials. Intravenous solutions are injected or infused directly into the vein and go immediately into the bloodstream. Intramuscular solutions and suspensions are injected deep into a skeletal muscle. Subcutaneous solutions and suspensions are injected just beneath the skin. Intra-articular solutions are injected directly into a joint. Intradermal solutions are injected into the dermal layer, like allergy test or tuberculosis vaccinations. Intrathecal solutions are injected directly into the cerebrospinal fluid. Solutions and suspensions are applied to mucous membranes of the nose as sprays or drops. Microfine powder solutions and gaseous drops are inhaled into the lungs using a metered dose aerosol inhaler or a nebulizer. A nebulizer is a device that turns solutions into vapors that can be inhaled. A is a picture of a proper use of an inhaler. B is using an inhaler with a spacer, also known as an aero chamber. And C is an AccuHaler, Advair. The major routes of drug administration are enteral, oral or parenteral, IV, IM, subcutaneous, inhalation, and topical. Enteral and parenteral and inhalation routes typically produce systemic effects. Systemic effects extend beyond the area of drug application or administration. Drugs that are applied topically usually produce a local effect. Local effects occur predominantly at or near the site of application. Some drugs that are administered orally produce a local effect, like antacids or neomycin, and some drugs administered by injection produce a local effect, like local anesthetics. Transdermal patches produce systemic effects. Oral administration is safe and easy compared with parenteral administration. No special techniques are required for administration, and if needed, the drug can be removed from the body via vomiting or binding with activated charcoal. We talked about earlier how it's generally less expensive than the parenteral dosage form, and all orally administered drugs must disintegrate and dissolve into solution before they can be absorbed or distributed. Oral administration is safe and easy compared with parenteral administration. Disadvantages of oral administration are variable absorption and decreased bioavailability. Bioavailability is a fraction of the administered drug dose that enters the systemic circulation and is available to produce drug effect. The extent to which a drug is absorbed and distributed to the site of action may be influenced by the presence of food in the stomach, which can delay the absorption of some drugs and aid the absorption of others. The first pass effect, a process where the liver metabolizes a fraction of an administered dose of a drug before it passes into the general circulation and also reduces bioavailability. Parenteral administration is preferred when the patient is unable to swallow or experiencing nausea and vomiting, or the drug is poorly absorbed via an oral route. Medications that are administered parenterally bypass the GI tract. Drugs administered parenterally directly enter the general circulation and therefore are not subject to degradation by GI and liver enzymes. The bioavailability of parenterally administered drugs is greater than that of orally administered drugs. An advantage of parenteral administration is the rapid onset of action. The amount of drug delivered parenterally can be carefully controlled by managing flow rates. The exact amount of drugs circulating throughout the body cannot be controlled when drugs are administered orally. There are disadvantages to parenteral administration of drugs. Aseptic technique must be used when preparing drugs for parenteral administration to avoid introducing life-threatening contaminants into the patient's bloodstream. After a drug has been administered parenterally, it cannot be recalled through vomiting. So table 1.6 lists summary of potential advantages and disadvantages of oral versus parenteral administration, most of which we've already talked about. So we have oral and intravascular there. Parenteral drugs must be administered using specialized technique. Proper injection procedures must be followed to avoid harm to the patient. When a large volume of a drug is to be administered intravenously, it must be injected slowly to avoid the destruction of red blood cells. Drugs formulated for IM administration may produce a rapid onset or a slow onset of action. Rapid onset formulations are typically prepared in water-soluble solutions. Slow onset, prolonged prolonged duration of action formulations are suspended in oil or other non-aqueous vehicles. And as the vehicle diffuses out out of the muscle into which it has been injected, the drug is slowly deposited. The drug is slowly released from the muscle's depot. Inhalation is one of the most effective ways to rapidly deliver drugs locally to cells of the respiratory tract and into general circulation. Absorption problems that are encountered with oral administration are avoided. Some of the side effects associated with oral or parenteral administration are minimized. And inhalation is an effective method for the delivery of medications used to treat asthma and other respiratory disorders. Some medications used to produce general anesthesia are administered by inhalation as well. Drugs that are formulated for transdermal administration are applied to the skin to produce systemic effects. Drugs such as nitroglycerin, estrogen, and testosterone, methylphenidate, Nicoderm, and scopolamine are available for transdermal administration. Topically administered drugs typically produce a local effect. For example, hydrocortisone cream applied to the skin will reduce itchiness and reduce redness associated with rashes without the systemic side effects associated with an oral administration of the drug, unless the drug is applied to a large percentage of body surface area.